Why do I pay Medicare copayments for different doctors? Have you ever wondered why your out-of-pocket costs can vary when you visit different doctors under Medicare? It can be confusing, but understanding how copayments and coinsurance work can help. Let's break it down. When you go to see a doctor, Medicare requires you to share some of the costs for covered services. This is where copayments and coinsurance come into play. Medicare Part B covers outpatient doctor visits and medically necessary services. After you meet your annual Part B deductible, Medicare usually pays 80% of the approved amount for these services. You are then responsible for the remaining 20%. This 20% is often called coinsurance, but many people refer to it as a copayment. Now, why do these amounts change depending on the doctor you see? It mainly depends on whether the doctor participates in Medicare and accepts assignment. Participating doctors agree to accept Medicare's approved amount as full payment. This means you will pay your 20% coinsurance based on that approved amount. The doctor cannot charge you more than this. On the other hand, non-participating doctors do not have to accept the approved amount as full payment. Medicare still pays 80% of a reduced approved amount, which is 95% of the participating doctor amount. However, non-participating doctors can charge you up to 115% of their approved amount. This can lead to higher out-of-pocket costs for you, which is known as a limiting charge. So, if you see a non-participating doctor, your copayment or coinsurance might be higher. Additionally, if you have a Medicare Advantage plan, which is also known as Part C, the cost-sharing rules can be different. These plans often have fixed copayments for doctor visits, and these amounts can vary by plan and provider. In summary, you pay Medicare copayments or coinsurance for different doctors because the cost-sharing depends on the doctor's participation status, the Medicare-approved amount for the service, and the type of Medicare coverage you have. Understanding these factors can help you manage your out-of-pocket expenses better.